Hi everyone, welcome to researchmd.com. We got another great presentation today. We're going to talk about a drug called ANAGRELIDE, okay? Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency program, transitional residency program, and I also teach medical students and medical residents. I'm also an assistant professor of medicine. So let's get into our subject. So what is the our topic again today is ANAGRELIDE, and let's look at the chemical name 6,7-dichloro-1,5-dihydropyrimidazole quintasolene 1-monohydrochloride monohydrate, and we have the chemical formula below there: C10H7Cl2 and 3OHCl H2O MW310.56. So what does it contain this drug? Sometimes it's good to know what is, sometimes it can cause allergies reactions. So we need to know what in a capsule of ANAGRELIDE, what's in there, right? Of course, you got ANAGRELIDE hydrochloride, inactive ingredients, black iron oxide, gelatin, cross-camerulosodium, lactose monohydrate, magnesium stearate, microcrystalline cellulose, hydroxyl propyl cellulose, propylene glycol, shellac and titanium dioxide, and potassium hydroxide. These are the components you get in the ANAGRELIDE. Now, what are the indications you're used? One, polycythemia vera, thrombocytosis in CML, and thrombocytosis and essential thrombocythemia. The four things, right? Polycythemia, thrombocytosis in CML, thrombocytosis, and essential thrombocythemia. So let's look at the mechanism of action. You got cyclic AMP phosphodiesterase inhibitor, inhibit phospholipase A2, and that inhibit the release of arachidonic acid from the phospholipase, disrupt the postmitotic phase of maturation, and decrease megakaryocyte hypermaturation, and then dose-related reduction in the platelet production. So mainly we decrease in the platelets based on this mechanism of action. Let's look at the dose. Its initial dose, 0.5 milligram 4 times daily, or 1 milligram twice daily, and you maintain the initial dose for at least 1 week and then titrate to reduce the depends upon the platelet count, to maintain the platelet count less than 600,000, okay? And you keep in the platelet ideally between 150,000 and the 400,000. So minimum single dose 2.5 milligram, maximum daily dose is like 10 milligram. Pediatric dose, 7 years or older, initially 0.5 milligram once daily for at least 1 week, and then titrate the lowest effective dose to maintain platelets below 600,000. Do not exceed 0.5 mg per day, and maximum single dose is 2.5 mg. And minimum single dose is maximum single dose is 2.5 mg, and maximum daily dose is like 10 mg. So let's look at some of the complications, or we say adverse effect, right? 8% of the people cardiovascular, like 8% have chest pain, edema, palpitation, peripheral edema, and tachycardia. In dermatology, there's pruritus and rash noted, and gastrointestinal can cause abdominal pain, diarrhea, flatulence, indigestion, loss of appetite, and nausea and vomiting. So a lot of GI complications kind of noted. This drug does have complications. All these things kind of cardiovascular, dermatologic, and gastrointestinal. Think about it, okay? Musculoskeletal, adult, this backache, neurologic is going to be like asthenia, dizziness, and headache. Respiratory symptoms could be like cough, dyspnea, and the fever, malaise, and pain. Let's look at the serious side effects, okay? Serious side effects are it can cause prolonged QT intervals, so it's better to check an EKG before and after. Torsades points, ventricular tachycardia, and hematological, it can cause like hemorrhage, but very few, 1% to less than 5%. Respiratory, it can cause interstitial lung disease. So monitoring, you monitor the platelet count every 2 days for the first week and once a week thereafter. You do a cardiovascular exam EKG, we already talked about the QT prolongation, complete blood count, hemoglobin, WBC, we can cause like hemorrhage, electrolyte, potassium, magnesium, calcium, electrolyte disturbances can, right? EKG, liver function test, QT prolongation, renal function, symptoms of underlying cardiopulmonary disease. So what happens in this drug in the hepatic if we have like liver failure, right? Moderate hepatic, again, we calculate the child-proof score, at least it is 7 to 9. You begin with a small dose of 0.5 milligram orally once daily for 1 week. If tolerated, may consider dosage increase. Do not increase dose more than 0.5 mg per day in 1 week. In severe hepatic impairment, let's say child-proof score greater than 9, avoid use. What about renal impairment? You don't need to do any renal adjustment, so you don't have to worry about if the patient has renal failure. That's pretty good. Pregnancy and lactation, don't use it. Fetal results cannot be ruled out. Lactation, the recommendation is breastfeeding feeding is not recommended during therapy, and you wait 1 week before the last dose. Okay, remember, 1 week after the last dose. Thank you so much for watching us. We'll be back with another presentation. Please subscribe to our channel. Thank you.